real measure of effectiveness of our work, our ability to actually save a woman's life.
Unfpa has done a lot for us to strengthen our leadership and also to help our counterparts in the other country to help them.
Unfpa offers all important services. When I was still at work, Unfpa used to help financially in sponsoring workshops and training. But when I have retired and I'm stayed home, Unfpa used me to go and use that skill to the Pacific Islands, to other communities and some areas in Fiji when there's a need arise.
They need 10 midwives, retired midwives, to volunteer for the Hurricane Pam at Vanuatu.
We were deployed there to help relieve the nurses who have been working day and night during the cyclone season, and we were to go and cushion the staffing there. Very busy time. It was a peak season for them.
After Pam, and there was 2016, we had the Hurricane Winston that struck Fiji. I was called to Levuka Hospital for 2 months.
And there were about 8 of us, and that was also funded by Unfpa.
After Tonga, I went to the Federated State of Micronesia to do one survey for reproductive health, funded by Unfpa.
In 2020, we went to Samoa when this measles epidemic was there.
We were deployed to do community health in the district hospitals. It was a shortage of staff in that hospital. So what they did, they sent the midwives on leave to take their leave while we were there, so for us to mend the place.
So we took over from the antenatal clinic, delivery, and the API and the family planning.
We were the 3 that went to Savai.
And in Savai, there are no doctors in Savai, no gynecologists. It's only the midwives over there because they admit, they discharge. And any high-risk cases, then they call. Otherwise, it's solely their decision. And thanks to my Samoan colleagues, I learned a lot from them. You have that confident, and you have to be competent to do that work.
The nurses trust us. Well, the place we were serving, it was a very busy place.
Like in a day, we used to do around about 12 deliveries per shift. It was quite busy at that time. They were very grateful to have us there, and likewise the people of Samoa too. When they see us, they are really happy, and when we are coming off duty, they still want us to stay back and do the deliveries for them.
We really work together, we work as a team, we work with them, and they really miss us when we left. That 10 weeks was really a good one.
For someone like me that has been at home for almost a year, that was an enjoyable moment for me. You know, being without a job and to go back and give back to the community, that was very rewarding. You know, everything just fall back into place. You know, I felt as if I was never retired.
Because of that midwife post, I've been able to travel.
And even though I have been retired, with that knowledge and skills, I can still share it out in the community where there is a great need in terms of women's health.
Okay, at this point in time, I would like to thank Unfpa for allowing the retired midwives with my mate sitting here to exercise their knowledge and skills again after they retired from the ministry and use it somewhere else. I thank the Unfpa for allowing us to go back and do the work because we already retired and staying home.
Ready for the next one?
We are ready for the next one.